invite Professor Wu to talk on the Micropulse laser for CSCR.
Thank you. So these are my disclosures, of which Lumimur Medical is a producer of the PDT laser and also the Micropulse laser. So CSCR is characterized by choroidal hyperpermeability, PD, and retinal neurosensory detachment. In most patients, there's spontaneous resolution, and in some patients, the disease becomes chronic with ensuing visual loss. So for these patients, the treatment has been used to treat these eyes. Adverse effects from PDT include transient reduction of macular function, RPE atrophy, choroidal non-perfusion, and secondary CNV. So in order to alleviate these side effects, investigators have used either half fluence or half dose of PDT, and both PDT protocols were effective in improving best-corrected visual acuity and eliminating subretinal fluid. However, choroidal hyperperfusion still occurred. The subthreshold laser eliminates iatrogenic damage from the laser photocoagulation, and is based on the principle that each laser pulse is divided into repetitive multiple short pulses separated by an off period, which allows the tissue to cool between the short pulses. The importance of multi-spot in subthreshold is that confluent laser therapy is possible, and there's a lower risk of undertreatment with the multi-spot. Monospot is very difficult in application when you have these invisible treatments. The most common cause of treatment failure is undertreatment. So my esteemed colleague, Dr. Jose Roca, was the first author of this paper, where we sought to compare the functional and anatomical outcomes of eyes with chronic central serous treated with the yellow subthreshold laser versus half-dose PDT at 12 months of follow-up. This was a retrospective comparative study of 92 eyes treated with yellow subthreshold laser and 67 eyes treated with half-dose PDT. Chronic CSCR was defined as the persistent subretinal fluid for 6 or more months. These were the treatment parameters for the subthreshold laser. Note here that it was a high density, and by that we mean that there was no spacing between the burns. In contrast, PDT, this was half dose, so rather than 6 milligrams, we used 3 milligrams, and 15-minute infusion, laser activation for 83 seconds, and the spot sizes ranging from 400 to 2,000 microns. The baseline characteristics between the two, the subthreshold laser and the PDT groups are here. You can see they're pretty well matched. And the 12 months results, you can see here that both were effective in reducing both the central macular thickness and the subfoveal choroidal thickness. But in terms of corrected visual acuity, the subthreshold laser was better. Here we see a little bit more detail, and you can see that the numbers suggest that the patients treated with the Micropulse laser did better than the PDT. And you can see here the curves above the PDT. Let me remind you, this is on a Logmark scale, so better visions with the Micropulse laser. In terms of anatomic outcomes, the PDT did a little bit better than the subthreshold laser. And the number of recurrences, you can see here that numerically there were more recurrences in the Micropulse laser compared to the PDT, but these was not statistically significant. In terms of complications, one eye developed CNV in the PDT group. Cases here, you can see the pre-treatment images, and then after the subthreshold laser, similar case here prior to PDT, and both you can see are able to improve the vision and get rid of the fluid. In comparison to other studies in the literature, our results are very similar. These are all retrospective case series. And another one that is a prospective study gave about the same type of results. This is half-dose PDT versus yellow laser, and you can see here the improvement in corrected visual acuity was similar in both groups. And this is the place study that Dr. Roca mentioned previously. And if you look at their protocol, they said that for the micropulse laser, it was supposed to be high density. But note that they use an 810 nanometer laser. And the 810 nanometer laser does not have the patterns. So you had to individually give the treatment and assume that you are not under-treating. So we wrote a letter to the editor, signed by Dr. Roca himself, and we asked that the laser were positioned adjacent to each other in a non-overlapping fashion. Try to imagine doing this treatment in vast areas of the fundus where the burns are actually invisible. So definitely there was under-treatment. So, and this is a prospective study from Hong Kong that actually showed that both the half-dose PDT and the yellow micropulse lasers are viable options for chronic CSCR. And in conclusion, both the half-dose PDT and the yellow micropulse laser are effective in restoring the macular anatomy in eyes with chronic CSCR. And it appears the yellow micropulse laser has a more beneficial effect in visual acuity than half-dose PDT. I didn't say that, Dr. Roca said that. Thank you very much for your attention.